cholesterol, and prior to the webinar starting, we had received some questions, and I wanted to answer a couple of those, and I'll answer them as we go as well. One, though, question was that someone had questioned whether cholesterol causes heart attacks, and cholesterol does contribute to having heart plaque and heart attacks, but it's not the only thing that contributes to it. And in our Cardio Wellness Center, that's what makes us so comprehensive, is we just don't look at cholesterol. I mean, there's sugar. Sugar can cause plaque buildup. There's so many more things. There's our waist circumference, inflammation, and all kinds of stressors on your body, hypertension, diabetes. So there's so many things that can lead to it, but if you only treat cholesterol, you're just going to get about a third of the event. But it is a third of the event with cholesterol. So we'll talk about the top tips to optimize your cholesterol and help reduce a third of those events. But some of the other webinars that we've had on Cardiotabs and in Talks We've done in our Cardio Wellness Center all help to prevent plaque buildup and future heart attacks. So when we're looking at cholesterol, we look at your good cholesterol, which is your HDL cholesterol, and how I remember it, HDL stands for high-density lipoprotein. So it's high. The higher you get it, the better off you are. Or happy, the more of it, you want more of it. That's your good cholesterol. The LDL is the low-density lipoprotein, so you want less of it. It's low. You know, it's bad. So you want less of it. And then triglycerides, those are also bad forms of cholesterol. And what those are just carbs and sugars you consume 3 or 4 days before the test. And so they can build up plaque. So your triglycerides for everybody, we want under 150. The good cholesterol for men, we want above 45, and for women, we would like above 55. And the bad cholesterol depends upon your risks. If you have heart disease, diabetes, or aneurysms, or plaque in your neck arteries or in your leg arteries, you know, we would recommend an LDL less than 70. If you've got 2 or more risk factors for heart disease, we would recommend an LDL less than 100, and then most everybody else would be under 130. So we either 70, 100, or 130, and most people have 2 or more risk factors for heart disease, which would be less than 100 on that LDL. So the tips today are going to talk to you about how to lower your LDL cholesterol, lower your triglycerides, as well as raise your good, the HDL cholesterol. So tip number 1 is to decrease saturated and trans fats. So what are saturated fats and trans fats? And also think about how many saturated fats you've had just this morning for breakfast, or maybe even last night for dinner. You know, saturated fats are animal fats. So those are your marbled meats, egg yolks, cheeses, milk other than skim, your ice creams, bacon, sausage, skin on the poultry. Try to think about how many saturated fats you've had and if there's ways that you can work to lower them. This looks at the differences in meat from wild, grass-fed, and grain and processed meats. And you can see here is a wild animal and how lean with not much fat in the meat here. And then here you can see grass-fed, and you start to see a little bit more marbled meat. And then when you get into grain and processed meats, you get a lot more fat. So, you know, wild meat is going to be much better than the processed meat. Meats that end in rounds and loins are usually leaner cuts of meat. So yes, you can have red meat, but try to stick with ones that end in loins or rounds or wild sources for your meat. A lot of people will say, you know, I'm getting my protein because I'm having sausage in the morning or bacon in the morning. Well, you're really having fat with a little bit of protein. And so this looks at sausage, and it shows you 74% fat, 22% protein. Your bacon is about 77% fat and 21% protein. Your hot dogs are about 83% fat and 13% protein. And then your ribs, you've got 73% fat and 26% protein. And of course, the T-bone steak, which everybody hates that I have it on here, but it's 68% fat and 30% protein. So start thinking about leaner cuts of protein or leaner options of protein. Also, So saturated fats and then trans fats are the other fats that, as we decrease, will lower your LDL cholesterol. And they're some of the worst foods on the planet. They're baked goods. They're often things that are in packages, because trans fats is where they've had hydrogen to it to keep it to last longer on the shelf life. So crackers, cookies, they're often in pastries and donuts and croissants. So start thinking about how many of these saturated and trans fats you had for dinner and dessert and breakfast today, and think about how you can decrease those. This talks about what you should eat, but why I have this here is because I have it written out. Lean proteins are right here. Lean proteins are going to be your healthy nuts, so nuts from trees, walnuts, almonds, pecans, Brazil nuts. Obviously, turkey, chicken, and fish are healthy, lean proteins. Red meat that ends in loins and rounds. Your egg white is a lean protein. Yes, you can have yolks. Limit it to 4 or 5 a week. You don't want to have 3 a day, but limit it to 4 or 5 a week if you're fine on eggs. All natural peanut butter is going to be a lean protein. You can put whey protein and make a whey protein smoothie. That's also a form of lean protein. You can get non-fat cottage cheese or non-fat plain Greek yogurt for your protein as well. So those are some options for some lean proteins for you. But if we can decrease the saturated fats and the trans fats in our diet, that will help to lower our bad or our LDL cholesterol. And this slide even goes a little bit into more detail as what should I eat. Many people are just confused out there. You know, I can't have carbohydrates because it raises my sugar and my triglycerides, but yet I don't want to have heart disease and eat more saturated fat. And we make it really simple. If you look at your plate, you should have a lean protein, and those are the options that I just went over with you, and at least 2 colors, fruits or vegetables. More vegetables, the better. We recommend no more than 4 servings of fruit a day, and half a cup is a serving. So lean protein and at least 2 colors on your plate. The more vegetables, the better. And avoid the fatty proteins and avoid pastries and sugary goods. So lean protein and vegetables and fruit is what we should eat. We should cut back on the saturated and trans fats in our diet. Tip number 2 is decrease simple and processed carbohydrates and sugars. And I want to first say with this, a lot of people will think, oh, we're saying no carbohydrates and no sugars. That's not the case. We want you to get plenty of carbs and plenty of sugars, but we want you to do it through vegetables and fruits. So decrease your simple and processed carbohydrates and sugars. So think about how many, maybe last night and so far for the day, how many sweets have you consumed? So regular soft drinks, even fruit drinks, Gatorade, fruit punches, fruit juices, and then, of course, your candy, cakes, cookies, pies, sweetened yogurt. And think about how many grain products you've had: rolls, bread, toast, muffins, bagels. All those will break down the carbohydrates and sugars. And in fact, someone that has a soda a day, in addition to what they're currently having, or if never had, if they weren't drinking a soda a day and they added a soda to their regimen, they would gain 17 pounds that year just by adding 1 soda a day without doing anything else. It would increase their risk for obesity by 60%, as well as their risk for diabetes by 40%. It's huge. Wheat bread, a lot of people will say, you know, I've had 2 pieces, you know, of wheat toast for breakfast, then I had a sandwich on wheat bread for lunch, and then I had a wheat roll for dinner. But wheat will break down to sugar. In fact, wheat will break down to sugar quicker than a Snickers bar. There's a book called Wheat Belly Total Health. That's really good if you want to learn all about it. You know, we've changed the seed of the grains over the years. It's got 30% more carbohydrates in it. So yes, white bread breaks down to sugar quickly, but wheat bread does as well, and it's still going to be a carb and a sugar. You get far more fiber in vegetables. So vegetables should be the main staple in your diet. You'll also get fiber in fruits as well. So we need to decrease simple and processed carbs and sugars in your diet. This is a picture I took of a patient's blood that came in, and they had high triglycerides. So remember, triglycerides are one of your bad cholesterol. We want everybody's less than 150. And all triglycerides are carbs and sugars consumed the last 3 or 4 days before your cholesterol test. So you can easily change your triglyceride number just by staying away from processed and simple carbs and sugars 4 days before your test. This is the blood tube. It starts here at the bottom and goes all the way to the top. This is the person's blood, even with the yellowish white stuff on the top. That's the triglycerides, the fats that have risen to the top. So this person had high triglycerides, and on this one, the blood tube actually is the yellow at the bottom. That's part of the tube that you see where the blood starts, and all the way to the top, all that fat, that extra whitish stuff on the top part here is all fat in the person's blood. And you can kind of see that it actually had a twist and it kind of torqued, and when I turned it upside down, that middle part just went sunk. So it was just a heavy cholesterol glob in there. And then this was the blood all the way from here to here as well. So this person's body was creating antioxidants from vegetables and fruits and have less carbs and sugars. But that's the flush that it has to push along, or the sludge that it has to push along in the artery wall. And anything that can nick an artery wall will start to build plaque. Once you have a nick in it, red blood cells come, white blood cells come, try to kill it, other cholesterol attaches to it, and then we start to have plaque buildup. So we want to do things that don't nick our artery wall, that we don't have to force all this extra carbs and sugars in our bloodstream through. I mean, and this is our heart arteries that we're talking about, but think about our smaller arteries in our brain. I mean, that's how a lot of dementia is caused too, is when we clog up those brain arteries. So the things we talk about today will also help you prevent some dementia and help you with just overall brain health and quality of life. So again, we want to cut back on simple and processed carbs and sugars. Have staple in your diet be vegetables. You will get plenty of carbs through vegetables and 4 servings of fruit a day. A serving is half a cup, or a tennis ball size apple or orange or peach, and those are your servings. So tip number 1 was to cut back on saturated and trans fats. That lowers your bad cholesterol, the LDL. Tip number 2 was to decrease simple and processed carbs and sugars in your diet. That will help to lower your your triglycerides, as well as your bad cholesterol. When we cut back on some of the sweets, like cookies, cakes, and pies, they have butter and eggs in them, so that'll also help to lower the LDL cholesterol too. Tip number 3, if you do have high triglycerides, a high dose of omega-3s can help you lower your triglycerides. So when you take omega-3 fish oils, the American Heart Association would recommend, if you have heart disease, it recommends 1,000 milligrams per day of the DHA plus EPA. And this is really important. There are many other omega-3s out there, and the ones that are studied to be heart protective are the DHA and EPA. So look on the bottle of your fish oil or your omega-3 supplement, and you want to make sure the DHA and EPA equals 1,000 a day if you have heart disease or plaque in your arteries. If you don't have heart disease or plaque in your arteries, the American Heart Association is recommending 500 milligrams of the DHA plus EPA combined per day, or 2 to 3 servings of fish per week. And then to lower triglycerides, this is the high dose. You need 2 to 4 grams, which would be 2,000 to 4,000 milligrams of the DHA and EPA combined. And the Cardiotabs have 3 fish oils, and here's the different strengths. And a lot of people ask me, what's the difference in their products, the 3 products that they have for fish oils. So this first one here was the original omega-3 that Cardiotabs first came out with, as far as the sizing of the capsule. And people love the sizing of the capsule. It's not a huge capsule like a lot of fish oils, so that's why we kept it, because people like the smaller capsule. And you can see there's 270 milligrams of the EPA and 705 milligrams of the DHA, and that's per serving. And so that would be, the serving here is 2. So you would have 975. Erin, is that right? Is that 2 on the first one?
Right. 975.
Okay. Right.
Oh, you take 3 soft gels a day for the serving
It's
size.
3. Excuse me. So the serving on that is 3 for the 975. So you have to take 1 more capsule to get the 975 or close to the 1,000 milligrams. The extra strength, and this is the one I recommend the most. This is the one I personally take, is the omega-3 extra strength. And it's a little bit bigger capsule. And so per serving, this is 2 capsules, and it would be 1,200 milligrams of the EPA and DHA combined. And this is the one I often recommend, but if people can't tolerate the bigger capsules, then I would go to the original omega-3 supplement. People that have high triglycerides, I do recommend the liquid omega-3, because in this omega-3 capsule, you can get about 2,200 milligrams in 1 teaspoon, just by having 1 teaspoon. And it's also got about 1,000 international units of vitamin D3 in it. So people with high triglycerides, the liquid is usually easier, because if you can take 1 to 2 teaspoons and get right what you need for lowering triglycerides. If you did an extra strength for lowering triglycerides to get 2,000 milligrams, you would need about 4 capsules a day. And in the liquid fish oil, this would need to stay refrigerated. So to lower your triglycerides, the tip would be to decrease simple and processed carbs and sugars. The best way to do it is to cut back on the simple and processed sugars, soft drinks, fruit juices, candy, cakes, cookies, and how many breads that you're eating a day, and switch that to making vegetables a staple and no more than 4 servings of fruit a day. You never have to go hungry. You can have all the vegetables you want, minus peas, corn, and potatoes. But you can have all the red, green, yellow bell peppers, radishes, cucumbers, celery, broccoli, cauliflower, green beans, squash, zucchini, asparagus, salads, all that you want. So you never have to go hungry. And then a good omega-3 supplement will also help to lower your triglyceride levels, a higher dose. Tip number 4 is not to drink your calories. A lot of people don't count, what they drink in as calories, and it really adds up. When I see my patients, one of the things I do ask them is what they had for breakfast, lunch, dinner, and snacks, and I include what did they have to drink at each one. Many people will say I have coffee in the morning, and I really have to stop and ask them, is that coffee from home? What do you put in your coffee? Is that coffee from Starbucks? Is it really a milkshake, or is it a coffee? Because even these Starbucks coffees and fancy coffees with whipped cream and milk and chocolate and caramel, I mean, you're having just carbs and sugars. So think about how much of that you're having throughout the whole day of what you drink. Alcohol is healthy if it's in moderation. And I have on here specifically what moderation means. That's 1 drink daily for women and 2 drinks daily for men. And that's 12 ounces of beer, 5 ounces of wine, 1.5 ounces of 80 proof distilled spirit. And just in case you were thinking it, you cannot save all your drinks for Friday night or Saturday night. So that's not good either. The great thing about alcohol is that it is heart protective and it's healthy for you, but it's also dangerous and can be detrimental to your health if you have too much. And so it's kind of a double-edged sword. You've got to be really careful with how much you're consuming. And there are also calories. If you're wanting to lose weight, that's empty calories for you. That'd be something that would be easy to give up until you've achieved an ideal weight. But again, 1 drink for women, 2 drinks for men. So in everything that I'm going over today, I'm also going to tell you what you should have. So it's not about what you don't want to have, but it's also about what you should have. So options for what you should drink: water, tea, unsweetened tea, of course, coffee. Don't add extra sugar and stuff to it. Black coffee, skim milk. Now that does contain some sugars in it, but it's got calcium and protein in it. So we say 1 glass of 8-ounce glass of skim milk a day is fine. Or you can get unsweetened almond milk. You can get low-sodium vegetable juice. Those are healthy drinks. If you want a soda, try some of the LaCroix water and Canadian Dry waters that are out there, because they're carbonated waters, and there's no calories, there's nothing in them. That would be another healthy option. So again, we're going to decrease saturated and trans fats in our diet. We're going to decrease simple and processed carbs and sugars in our diet. We're going to have high-dose omega-3s to help lower triglycerides, and we're not going to drink our calories. The next tip is to be active or to get in plenty of exercise. You know, back in the day, our grandparents, our parents, you know, they would burn about 300 calories per hour. Today, it depends on if we stop by McDonald's or Starbucks or all the many fast food places on the way to work, that we gain calories before we even get to work or before we even start to burn off calories. And oftentimes, we don't even, you know, burn the calories we possibly could burn. We don't take the stairs. We don't go up that hill. We go the other way around it before we don't have to go up the hill or exert that energy. And my rule of thumb has been, if you don't have internal discipline for something in your life, and there's something in everybody's life, whether it's finances, whether it's alcohol, whether it's food, no matter what it is, whether it's exercise, if you don't have internal discipline to do it, set external accountability. So whether that's a personal trainer, meeting friends for it, or make it in your life, make it a part of your everyday life. Because being active and doing and completing exercise every day decreases your blood sugars, lowers your bad cholesterol, which is your triglycerides as well as your LDL, decreases blood pressure, decreases your clotting risk, increases your good cholesterol, helps to prevent diabetes, increasing insulin sensitivity, and it's the best thing you can do for anti-aging. And if I told somebody I had a pill that did all that, they would say, I don't care what formulary it's on, I'll pay for that. We all have access to it, and it's getting in daily exercise. Another thing that we encourage at our Wellness Center is to get a personal monitoring device. My personal one is Fitbit. Everybody has different ones. There's Polar Loop. Garmin has VivoFit. There's so many different ones that are out there. And set your goals. You know, 10,000 steps a day. You can see on this one, you know, that the goals were met. You know, the 5 miles were made. The 10,000 steps were completed. How many calories were burned. How many active minutes for the day. How many floors climbed. And it even gives you weekly updates. It'll also tell you about your sleep. And the best thing I can tell you about daily activity and exercise is included as an everyday part of your life. So this was a time that my family and I went to Alaska, me and my husband and son Evan here, and we went to Alaska, but we made a point every day to have a hike, and on this day we went up and we hung out for a few hours, like 4 hours, with all the different dogs that were there driving the sled. And we exercised with them and played with them. We just got back from a trip to Colorado where we had hiking every day, but we included it as a part of our trip and a part of our vacation. So I do have a lot of patients that say, well, I went on vacation and I didn't eat well and I lost my exercise regimen. Well, it should just be a part of your everyday life. So try to plan being active as a part of your everyday life. And if you don't have the discipline to do it, set the external accountability for it. Tip number 6 is to stop smoking. In fact, smoking is really a deal breaker on your health. I really have this one slide here because I think we all are aware that smoking can lead to many things, including heart disease. But I think this was pretty powerful. It's a risk factor. Smoking is a risk factor for 6 of the 8 leading causes of death in the world. So of the 8 leading causes of death in the world, risk factors for those is smoking, of 6 of them. That would be ischemic heart disease. This would be stroke. This would be respiratory infections. This would be COPD, chronic obstructive pulmonary disease. It would be tuberculosis, and it would be trachea, bronchus, and lung cancers. So those are the 6 that tobacco use contribute to. So basically, if you're smoking, stop. We do actually have a really great smoking cessation program through our Cardio Wellness Center if you're interested. We do them about 3 or 4 times a year, and Janice is a health coach that leads through them. We've got wonderful success with it. So if you smoke, stop. That will raise your good cholesterol. If you're smoking and you stop smoking, it will raise your good cholesterol. Next tip number 7 is to achieve an ideal weight. And This talks about the question that somebody had earlier that I've answered, if cholesterol causes heart attacks. And this was actually a study that looked at what was the major cause of someone's acute myocardial infarction. Myocardial infarction is heart attack. So they had an acute heart attack when they came to the hospital. What was the major cause? This was the inner heart study. And in this particular study, 49% was from abnormal cholesterol levels. But the next thing that weighed in before hypertension and before diabetes was abdominal obesity. That is huge. A lot of people don't realize how detrimental the fat is around our abdomen, where all of our organs are housed. And why is it? Well, because fat cells aren't created equal. We used to think these fat cells around our abdomen, as well as around our buttocks and thighs, were all just storage depots and didn't do anything. We have learned differently that the fat cells around our abdomen are highly active. In fact, these are all of the chemicals that is secreted by those fat cells. And so I don't expect you to know what all of this means, but basically this angiotensin raises your blood pressure, can cause hypertension. Increased free fatty acids and increased insulin leads to diabetes. All of this down here leads to clotting. All of this is inflammatory, leads to arthritis and asthma. And this is all the organ systems that are affected by the secretions from the abdominal fat. It can affect our lungs through asthma, obstructive sleep apnea, hypoventilation. It can affect our liver for non-alcoholic fatty liver disease. In fact, 1 in 3 Americans have a fatty liver, and they don't even know it. And fatty livers will be the #1 cause for liver transplant here in the near future, as well as people with fatty liver can be an independent risk for heart disease. And again, 1 out of 3 Americans have this. We're starting to screen on the cardio scans or the calcium scores of the heart that we're doing. We're going to screen a little over and check for fatty livers in our patients. And all fatty liver is that you're consuming too many of the simple and processed carbs and sugars, and your liver can't process them. Your liver works to process all the food you eat, and it can't keep up. And so it causes inflammation at the liver site, and when that inflammation turns to scar tissue, we don't get that function back from the liver. The adipose tissue, the fat tissue around our abdomen, can also cause gallbladder disease, can cause abnormal menses, infertility, polycystic ovarian disease, osteoarthritis, can lead to stroke, cataracts, heart disease, high cholesterol, high blood pressure, can cause severe pancreatitis, can lead to some cancers, and even phlebitis. So the fat cells that are around our abdomen, again, are highly active. They're not just a storage depot. This is a body scan, and it shows the fat, and you can see it's a 100-pound difference. And you can see how much fat is sitting around the organs on the right one versus the left, and all the pressure it's putting on the organs and how unhealthy this is. So it's really imperative that we work on achieving our ideal weight. And you don't have to really count calories. Count how many colors are on your plate and make them vegetables. So lean protein on your plate and vegetables. At least 2 colors, more vegetables, the better. And the 3 vegetables to be careful of are corn, peas, and potatoes. And if you really want to measure yourself and say, where should I be or what should my weight be, we really go by waist circumference. Your waist circumference should be half your height in inches. So your waist circumference should be half your height in inches. And the next question I get is, well, where do I measure my waist? It's the top of your hip bone. If you can't find the top of your hip bone, if you lean far to the right, you'll feel it, and then lean far to the left, and you'll feel the other one. And that's where the tape measure goes. And then it goes through what goes through the door first to the front part of your abdomen. It doesn't go low underneath it. It goes through the door first, and that's how you measure your waist circumference. And again, that should be half of your height in inches. So if you're 70 inches tall, your waist circumference should be 35 inches. Next tip number 8 would be to eat for health, and I've already discussed that. A lean protein and at least 2 vegetables. And I like this tip, eat for your health, because I have a lot of patients that say, well, I don't like vegetables, or I don't like some of the healthy proteins. And one of my mentors, who's since passed away, who's a cardiologist, many of you probably know him, Dr. Bob Kahn, he used to say all the time, eat for health and you will develop a healthy taste. So eat for health and you will develop a healthy taste. And I think that's really important. You'll start actually craving these things if you've had them and then you don't have them for a while. The next thing that I always tell my patients is that feed your organs first, meaning your organs need protein and vegetables. In fact, every color of the rainbow has some vitamin, nutrient, mineral that our body needs. You should have the color of the rainbow every day. If you don't get it every day, at least every 2 days. But feed the organs first before you even consider having anything bad, because that's why we're supposed to eat, right? It's to feed the organs first. The size of your meat, you carry it on your hand. Usually the portion size is the size of your palm, and the second knuckle is about the thickness of the meat that you should have. You know, it's interesting, if you go to a restaurant and you're, let's say, 5 foot, and you have a 6-foot friend, and you go to dinner and you order the same meal, they give you the same amount, correct? Well, when they give you the same amount, the 6-foot person and the 5-foot person, if they eat the same amount, the 5-foot person is going to get overweight. So you've got to decide what your portion is, not what the restaurant or whoever's serving you, what size the portion is. And again, I already talked about vegetables and fruits, that every vitamin and mineral has something that you need for your body. Every color has some type of vitamin, mineral, or nutrient that you need for your body. They're powerful in antioxidants, phytonutrients. They work to protect against oxidative damage that occurs with stress, and that can lead to even cancer cells. And it reduces your risk of heart disease, and it enhances your immune system. So there's so much that color, the vegetables and the fruit, can do for you. And always look at your plate. After you've filled it up and you've got everything on your plate, look down. Is it loaded with color? How does your plate rate? Is it loaded with color? And the last 2 tips are going to be supplements and prescriptions. So tip number 9, we'll talk about over-the-counter supplements. I often get asked, what supplements do you use and why? I often will use the Cardio Tea. It's actually I take the Cardio Tea myself. It's 2 capsules a day. It does support your immune system. It will naturally increase your metabolism, and it does support healthy cholesterol levels. Phytosterols, Cardiotabs has one in the form of cardiosterols. There's phytosterols, is basically plant sterols, and they also support healthy cholesterol levels. You need about 1,500 milligrams of them, and whatever bottle you have, you can turn it around and you can see how many phytosterols are in it. And you want 1,500 milligrams to take with your biggest meal, and that will help to support a healthy LDL cholesterol. And the cardiosterol brand, it's 3 capsules with your healthy meal. And next I'm going to talk about prescription medications. Those are other ways to lower your cholesterol. And I do have some questions that I will address that have come in prior to the webinar. One question was saying that they heard statins were bad for a person. And I think some people can't take statin medications, but for the most part, statins really aren't bad for people. And in fact, any clinical way that your plaque could show up, meaning if it shows up in the form of a heart attack, stroke, claudication symptoms where your leg hurts doing your walk because it's got plaque in it, any of the clinical ways that your plaque can show up and hurt you, statins have been known to reduce. That's why it's the #1 recommended treatment for reduction of cholesterol values, because it has outcomes data that shows it can reduce those events. The cholesterol absorption inhibitor, Zetia, we give with statins if we can't get people at goal, or sometimes people can't take a statin, and sometimes we lower their statin really low, and then we add Zetia to them. We get it at a dose that they can lower, and or we get them at a dose they can tolerate, and then we lower the cholesterol the rest of the way with Zetia. And Zetia is not a statin, and recent studies have shown when we added Zetia to the statins, there was further reduction in heart events. Another person had asked that they thought they were having issues, memory issues, or mental confusions with statin drugs. They wanted to know if the statin contributed to it. So I've done nothing but this really for 15 years, and I can tell you in regards to statins and memory loss, I have not seen that happen. Now, I've had maybe a handful of people when I first put them on a statin, they all describe it the same way. They say I'm kind of in a brain fog. You know, I'm having a hard time balancing my checkbook, which I've never had before, or just little things that they feel is a brain fog. You take them off of it, and it immediately clears up. And then we'll just try a different statin, and often we're fine. But that's only happened like 5 or 6 times. It doesn't cause memory loss in the long term. In fact, studies have shown that it actually helps to reduce dementia. The next class, which is the newer class of medications that I wanted to share with you, they've recently been approved by the FDA less than a month ago, and we're using them on patients. They're called PCSK9 inhibitors. The 2 drugs that are out are alirocumab, which is Praluent is the other name for it, and evolocumab, and that's for Kappa. But we have 2 companies so far that have them out, and those are the 2 different drugs, and I'll talk to you next about how they work. This, however, is a sub-Q injection. It's like an insulin injection. It only goes 4 millimeters into your skin, so it's not a very intrusive shot at all. You give it to yourself twice a month, every 14 days or every 2 weeks, and that's how they're administered. And let me show you how it works. So we all have, or most of us, there's about 3% of the population that doesn't have PCSK9, but for most of us, we all have these blue PCSK9s. All these blue molecules here are PCSK9. And remember, what I'm talking about are PCSK9 inhibitors, okay, that inhibit what PCSK9s do. All right, but first of all, I'll show you what PCSK9s do in our system. The top part of this picture is going to be the bloodstream, and below here is going to be the liver cell, the hepatocyte, okay? What happens naturally is this blue PCSK9 attaches itself to this red LDL receptor, and the LDL receptor comes out of the liver to grab LDL particles. Okay, so the PCSK9 attaches itself to the LDL receptor. Here, PCSK9 LDL receptor, it grabs hold of the LDL molecule, and it pulls it into our liver cell. So now we're into the liver cell called the hepatocyte. And it transfers to a vesicle, into an endosome, and then the lysosome is where it breaks down the LDL molecule. But it also breaks down the LDL receptor. So we don't have the LDL receptor coming back out to get more LDL. We're having to wait till we get more made, and then the ones above that attach themselves to PCSK9 and come back into the liver. And then again, we have both destruction of the LDL molecule as well as the LDL receptor. So what does the inhibitor do? The PCSK9 inhibitor will actually the PCSK9 and the LDL receptor will come in together. You don't see the PCSK9 here. They come in together. They come into the vesicle. They come into the endosome. The LDL then goes on to the lysosome, but the LDL receptor is able to come back out to the bloodstream and to attach itself to get more LDL particles. So by having a PCSK9 inhibitor, we have more of these LDL receptors to bring into the liver cells and to destruct the LDL cholesterol, which is wonderful. There are some patients in the world, there's some people in the world that live with mutation in their DNA where they don't produce as much PCSK9. The R46L is a Caucasian mutation, and there's the ERIC trial and the Delacarte trial. Those people had a 15% lower LDL cholesterol, but about a 50% reduction in heart disease risk. African Americans, there was 2 different variants noted, or mutations noted, and they had a 28 to 40% LDL reduction. and their heart risk was 88% reduced. They've actually followed a family where an African-American male and female got married. Each one of them had a different mutation, so both mutations were covered. The daughter got both of those mutations. She has no PCSK9 in her body, so no PCSK9. Her LDL is about 14, so they followed her to see how her cognitive level would be, fertility would be, and her overall health. And she graduated from college. She's had 2 kids, and she's an aerobic instructor in addition to her main job. So very, very, very healthy. The 2 drugs that have come out, they have done efficacy and safety trials on them. This is just looking at the alirocumab. It was the first one that came out. It came out, I think, maybe 1 or 2 weeks before evolocumab did. But you can kind of see how it's processed. You know, they first discovered even PCSK9 in 2003. It looked at what mutations occurred in some animals, and it targeted human validation. Their first human subject, was treated in 2010. They've done phase 2 and 3 trials, which look at safety and efficacy of the medication. What they found were anywhere between, on both of them, they found anywhere from a 50 to 70% reduction in LDL cholesterol. And these people were already on statin medicines because it would be unethical to do a trial of a new medication without giving somebody the statin medicine that's been known to reduce events. So this trial was done with patients already on statins. They added the PCSK9 inhibitor to their current therapy, and they had anywhere from a 50 to 70% reduction in their bad LDL cholesterol. Outcomes trials are going to be out in 2017. The FDA approved alirocumab as well as evolocumab just in August, September of 2015. Side effects associated with these, if somebody wrote in and wanted to know what the side effects were of these new medications, it's really interesting. They really have had hardly any side effects associated with them. Injection site irritation, runny nose, colds, upper respiratory infection. I don't know if that's because that's the type of year it was done in, but they had no muscle aches and pains, doesn't affect the liver, basically no major side effects when compared to placebo. So they've been very good. You take these shots twice a week. It's kind of got a self-injector. So we're looking forward. We're getting more and more patients on those. To qualify for those drugs, I just want to go back. You have to have known heart disease, and you have to be on the highest tolerated dose of a statin. So if you can't take a statin, you're taking it twice a week, that's your highest tolerated dose. So you have to have a highest tolerated dose of a statin, and you have to have heart disease to qualify for the PCSK9 inhibitors. All right, so our top 10 tips to optimize cholesterol were to decrease saturated and trans fats in your diet, decrease simple and processed carbs and sugars in your diet, high-dose omega-3 fish oils to lower your triglycerides, remember not to drink your calories, be active, make it a part of your everyday life, get exercise every day. If you're smoking, stop, achieve and maintain your ideal weight, eat for health, use good supplements that you know work, and prescription medications if you need them. We all want to look like this lady that's jumping up, but we got to make the lifestyle and dietary modifications in order to do so, because what we don't want to do is we don't want to end up like this at the end of the day with all these things to accomplish, and we're just too tired and lethargic to do it. And it's often because of what we're eating. So can we change our American lifestyle? And yes, we can. Okay, I can take further questions, Aaron, or stay on the line if you
Sure.
see.
Yeah, we've had several questions submitted throughout the webinar. Let's talk about things that we can eat and what your thoughts on are white rice, potatoes, pasta, and steel-cut oats.
Okay, so white rice, potatoes, pasta, and steel-cut oats. Let's leave out the steel-cut oats first. white rice, pasta, and potatoes. Those are all going to be carbs and sugars, and they're all going to break down the sugar. Can you have a potato every now and then? Sure, but I wouldn't have a potato the day that I have corn, or if you're going to have bread or whatever, because it's just going to add more carbs to it. So you got to limit how many times you have pasta or how many times you have the potato. Pasta is a little bit different beast. Pasta is really there's nothing healthy in pasta for you. If you want pasta, then have it as a side dish, or load it with vegetables with a little bit of pasta. Pasta is going to be carbs and sugars, so just know that it's not feeding your organs. It's not protein, and it's not vegetables or fruit. But load it with vegetables and have a little bit of pasta with it. Make it a side dish. Don't make it, the family platter that you put in front of you to eat, because a lot of times I know they serve it that way. Rice, so white rice is going to break down the sugar. The 4 grains that we say are okay would be wild rice, steel-cut oats, barley, and quinoa. Even on those, we say no more than a half a cup to a cup a day of those grains. And again, it's not going to be a protein, and it's not going to be a vegetable or fruit. So you're not feeding your organs with it. That's just something extra that you're having that will break down the carbs and sugars. So if you're trying to lose weight, I would stay away from those. And if you're worried about being regular or fiber, the more vegetables you have is the more fiber you're going to get in your diet.
All right. How about this question? Do you worry about a fasting LDL-P of 1400 when the rest of the cholesterol panel is WNLS?
Okay, within normal limits. So the rest of the panel is within normal limits, and the LDL-P is 1400. Does they say if they have heart disease or not, Aaron?
No.
Well, if you have heart disease, like to see that a little bit less. Like to see it under probably 1,000 or 1,100 if you have heart disease. If you don't have heart disease and you're at 1,400, I would just do some maybe over-the-counter supplements or some diet and lifestyle changes to see if you can't get that down a little bit less. And it would go along with other things. So it's really hard to look at cholesterol. I mean, if you're overweight, you've got abdominal fat, and you eat a lot of sugars, even though you might have your sugars controlled on this. If you eat a lot of sugars, that's detrimental to your health. And a lot of sugars can increase particle numbers. And how is it detrimental to your health? So if you were to sit down and have a big pasta meal, you're going to have a sugar spike. Or if you were to sit down and have cereal in the morning and orange juice and toast, you're going to have a big sugar spike. When you have that sugar spike, it's inflammation disease to the artery wall. Your sugar is coming down, your artery wall is trying to heal, and oftentimes we're back to our next sugar spike. It's the sugar spikes that hurt us. So 1,400 and everything else, diet and everything else is controlled, probably wouldn't make too big of a difference. I would work to try to get it down closer to 1,100. If you had class, definitely 1,100 or 1,000 is where we'd want it to be. Thanks.
Yeah, that's a great answer. You spoke earlier about omega-3, the DHA, and the EPA. Can you go over the specific benefits of DHA and why, and EPA, and why DHA might be more important?
So, I mean, the best thing that I say about the DHA and EPA, and the reason why they do more, Cardiotabs does more DHA and EPA, is it's the same ratio that's in fatty fish that's in all studies. So we don't, and EPA also works more like a blood thinner. So we do exactly what's in the studies on the fatty fish. It's the same DHA and EPA ratio. And that's one of the great things about Cardiotabs products and Dr. O'Keefe and his wife Joan owning it and leading it is because they look at the scientific studies and match their products to the scientific studies. And not only that, I mean, they've been, Dr. O'Keefe's been, out to Norway where it's made and sees it and processes it, and they have a third-party lab that actually checks the product, so that they even have their own person come test it. So the best thing that we like about it is that it's the same ratio that's in the studies that helps reduce, sudden death in the GISI trials, lowers triglycerides, and good for brain health. DHA is good for brain health.
What about coconut oil? There's been a lot of press about coconuts in general, whether it's for the oil or coconut milk. What are your thoughts on that?
So coconut oil, you know, it's kind of hard working in cardiology to say it's okay. We've had people that start taking a bunch of doing coconut milk and coconut oil, and it does raise their LDL. It's a saturated fat. It does raise your LDL. You've got to be careful how much of that you're using. That's what would be my take on it. I saw and read all those things, and I think, yes, for the most part, it's healthy. But like everything, you know, once we find something that's healthy, we tend to overdo. So if you do it in moderation, you're fine. If you're going to have it every day and have large amounts of it, your LDL, your bad cholesterol is going to go up.
Let's see. We have some other questions that have come in. Can you have too high of an HDL?
Good question. I mean, they're all great questions. So this, not that you can have too high of an HDL. We have some people that really have this real high HDL cholesterol, and they don't really exercise, and they're overweight. Or maybe they exercise, you know, and they're not overweight, and they have this just astronomically high HDL in the 130s, 140s. We don't know. I mean, that could be a risk, actually, because we don't know how much HDL is actually functioning HDL. But we do know when you exercise and when you lose weight, you produce functioning HDL cholesterol. So if you're exercising and you maintain an ideal weight and your HDL is really high, it would probably be just fine. But just because you have a high HDL does not mean that you should forgo treating your LDL and your triglycerides. I mean, the number one thing to treat is LDL. In fact, the new guidelines from the National Lipid Association would say the primary targets are LDL and what we call non-HDL. And non-HDL is exactly what it sounds like. It's your total cholesterol minus your HDL cholesterol, minus your good, because all the rest is the non-HDL, which is all the bad particles. And we really should be treating primary targets are non-HDL and LDL, regardless what your HDL cholesterol is or isn't.
What about, so back to the coconut oil question, what are your thoughts on EVOO, I'm not sure how to say it, EVO, and or avocado oil?
No, anything healthy, extra virgin olive oil, yeah. No, they're healthy oils.
They're both good to include in your diet, no side effects or downsides?
Right, and you know, when you're talking about oils, like when I'm telling someone to gain, I mean, I don't know who I'm talking to, someone's overweight or not overweight, but when I'm telling people to gain weight, I tell them to eat more nuts, eat more peanut butter, and eat and put like vegetables and salads and load it with those types of oils. You know, because they're high in fat, high in calories, but they're good fat. So everything's got to be limited or you're going to gain weight on them. But they're good fat.
Do you think type 2 diabetes makes it harder to lose belly fat?
Well, some of it, like if you're on insulin, it can be harder to lose it. If you're not on insulin, I mean, if you're on some oral medications, you got to be careful because as you change your diet, you could cause your blood sugar to go down. And oftentimes, if your blood sugar goes down, then you eat sugar, and we're feeding the medicine. You know, so if you're not on insulin, which causes weight gain, if you're not on insulin and you're just on an over-the-counter, or not an over-the-counter, you're on a prescription medication for your diabetes, if it's just metformin, you won't have low blood sugar. So if it's just metformin, I encourage you to change your diet, lean protein and vegetables, and no more pork and fruit. And you shouldn't have a harder time of losing the belly fat than a non-diabetic person. But if you're on other oral agents to lower diabetes besides metformin, they can cause hypoglycemia, low blood sugar. So you'd want to talk with your endocrinologist or the nurse practitioner that's treating you, or primary care physician that's treating you on that, and work to say, hey, I'm going to change my diet. How do I do this where I'm not feeding the medicine? And oftentimes that's what we do. We want to lose weight, but then our sugars drop, so then we have to eat sugar, and then we feed the medicine.
if you are looking to target specifically your LDL-P, do you think exercise or prescription medications or specifically supplements will all aid in that, or is there one in particular that will target that LDL-P more so than the others?
Well, a high dose omega-3 fish oils helps to reduce particle size. Exercise weight loss will help to reduce it. If you're not taking a statin medicine now, I personally would recommend, I would personally recommend over-the-counter red yeast rice. And of course, some of them are just placebo, and they really don't do much. So you got to be careful and get a good quality brand. That's why I use Cardiotabs. But I have seen clinically, as a provider, I have seen great results with that. And you would have to start, I think Cardiotabs, I know they recommend 2 twice a day, but you would at least need to have 2 to 3 a day to get the LDL particles down. That with high-dose fish oils, and if you're overweight, if you want to lose 5 or 10 pounds, and exercise, you'll see your particles change.
Most of your suggestions probably have been centered around middle-aged adults. What about kids who are having issues with some of these problems, especially belly fat? Or can all of these recommendations be applied to them?
Yes, I mean, kids. I mean, this diet is how every American should live. Every kid should have a protein and 2 colors. That should be the plate. I mean, this isn't different for anybody else. I think we make it easy because a lot of people get confused. What should I eat? Kids don't know. In fact, Wednesday nights at our local church, I used to help out some kids. The youth services there, and you know, they would have a concession stand, and kids would be wanting just sugar. They're not hungry. They don't want dinner. They're having sugar withdrawals and they need sugar. So kids are kind of even confused as to what to eat, and they need protein and vegetables. That should be the staple in their life. They should get exercise. Fish oils are good for children. I would not do red yeast rice. I know I just brought that up, but I wouldn't for adults, but I wouldn't do it that for children at this time. The most part for kids is just teach them a healthy lifestyle.
All right, Becky. Well, thank you very much. We've reached the end of our webinar. Appreciate you joining us. You had a lot of great suggestions, and thank you everyone for taking time out of your day today to attend. Hopefully you walked away with lots of good advice on how to support your own cholesterol levels. If you'd like to provide any feedback to us, you can visit our Facebook page at facebook.com/Cardiotabs. Leave your comments and questions there, or comment on future webinar topics you'd like to hear, and we can certainly consider it. Otherwise, have a great rest of your day, and thank you so much for joining us. Thank you, Becky.
Thank you. Thanks, everyone, for joining.
Bye.